Urinary Incontinence Things You Should Know, Questions and Answers, by Rumi Michael Lee. Introduction. I would like to thank and congratulate you for listening to this book, Urinary Incontinence, Things You Should Know, Questions and Answers. This book will help you understand, revise and have a good general knowledge and keywords of urinary incontinence, and how it affects the lives of people who suffer from urinary incontinence. Chapter 1. 1. What is urinary incontinence? Urinary incontinence is urinating without being able to control it. 2. Is urinary incontinence a common problem? Yes, urinary incontinence is a common problem. 3. What is the function of the bladder? The function of the bladder is to store urine. 4. Can urinary incontinence be temporary? Yes, urinary incontinence can be temporary. 5. Is urinary incontinence more common in women than men? Yes, urinary incontinence is more common in women than men. 6. Can urinary incontinence happen to anyone? Yes, urinary incontinence can happen to anyone. 7. Urinary incontinence can also be called. Urinary incontinence can also be called an overactive bladder. 8. What are the main parts of the urinary system? The main parts of the urinary system are the kidneys, the ureters, the bladder, and the urethra. 9. What is the function of the ureters? The ureters connect the bladder to the kidneys. 10. What is the function of the urethra? The urethra allows urine to leave the body. Chapter 2. 1. Are there different types of urinary incontinence? Yes, there are different types of urinary incontinence. 2. Can incontinence be mixed? Yes, incontinence can be mixed. 3. What are the different types of urinary incontinence? The different types of urinary incontinence are total incontinence, urge incontinence, stress incontinence, overflow incontinence, mixed incontinence, and functional incontinence. 4. What is total incontinence? Total incontinence is incontinence caused when the bladder is not capable of storing urine. 5. What is urge incontinence? Urge incontinence is incontinence caused by the intense urge to urinate. 6. What is stress incontinence? Stress incontinence is incontinence caused by pressure on the bladder. 7. Give an example of when stress incontinence can happen. Stress incontinence can happen when a person laughs. 8. What is overflow incontinence? Overflow incontinence is incontinence due to the fact that a person cannot fully empty his/her bladder. 9. What is mixed incontinence? Mixed incontinence is when you have more than one type of incontinence. 10. What is the most common type of mixed incontinence? The most common type of mixed incontinence is urge incontinence together with stress incontinence. Chapter 3. 1. What is functional incontinence? Functional incontinence is when a physical or mental health problem prevents a person from going to the toilet. 2. What are some factors that may lead to temporary urinary incontinence? Caffeine, alcohol, and spicy foods may lead to temporary urinary incontinence. 3. Can a urinary tract infection cause urinary incontinence? Yes, a urinary tract infection can cause urinary incontinence. 4. Can constipation cause urinary incontinence? Yes, constipation can cause urinary incontinence. 5. Can pregnancy cause urinary incontinence? Yes, pregnancy can cause urinary incontinence. 6. Can childbirth cause urinary incontinence? Yes, childbirth can cause urinary incontinence. 7. Can menopause cause urinary incontinence? Yes, menopause can cause urinary incontinence. 8. How can menopause cause urinary incontinence? Menopause can cause urinary incontinence due to the diminution of estrogen. 9. What is menopause? Menopause is the period that ends a woman's menstrual cycle. 10. Can an enlarged prostate cause urinary incontinence? Yes, an enlarged prostate can cause urinary incontinence. Chapter 4. 1. Can neurological disorders cause urinary incontinence? Yes, neurological disorders can cause urinary incontinence. 2. Give examples of neurological disorders that may cause urinary incontinence. Examples of neurological disorders that may cause urinary incontinence are Parkinson's disease, multiple sclerosis, stroke, etc. 3. What is Parkinson's disease? Parkinson's disease is a disorder of the brain that affects movement. 4. What is multiple sclerosis? Multiple sclerosis is a chronic disease of the central nervous system. 5. What is a stroke? A stroke is a life-threatening condition due to a block of blood supply to a part of the brain. 6. Can a spinal cord injury lead to urinary incontinence? Yes, a spinal cord injury can lead to urinary incontinence. 7. Can sedatives cause urinary incontinence? Yes, sedatives can cause urinary incontinence. 8. Can antihypertensives cause urinary incontinence? Yes, antihypertensives can cause urinary incontinence. 9. Can cystitis cause urinary incontinence? Yes, cystitis can cause urinary incontinence. 10. What is cystitis? Cystitis is the inflammation of the bladder. Chapter 5. 1. Is obesity a risk factor for urinary incontinence? Yes, obesity is a risk factor for urinary incontinence. 2. Is gender a risk factor for urinary incontinence? Yes, gender is a risk factor for urinary incontinence. 3. Is age a risk factor for urinary incontinence? Yes, age is a risk factor for urinary incontinence. 4. Is smoking a risk factor for urinary incontinence? Yes, smoking is a risk factor for urinary incontinence. 5. Is diabetes a risk factor for urinary incontinence? Yes, diabetes is a risk factor for urinary incontinence. 6. What is diabetes? Diabetes is a chronic disease that causes high levels of blood sugar and leads to complications. 7. What is nocturia? Nocturia is frequent urinating at night. 8. What is the most frequent cause of urinary incontinence in men? The most frequent cause of urinary incontinence in men is an enlarged prostate. 9. What is prostatitis? Prostatitis is the inflammation of the prostate. 10. Is prostatitis painful? Yes, prostatitis is painful. Chapter 6. 1. What are the complications of urinary incontinence? The complications of urinary incontinence are urinary infections, skin problems, skin infections, prolapse, etc. 2. What is a prolapse? A prolapse is the sagging of an organ from its normal anatomic position. 3. Can urinary incontinence lead to emotional problems? Yes, urinary incontinence can lead to emotional problems. 4. How can urinary incontinence be diagnosed? Urinary incontinence can be diagnosed by a physical exam, urine test, stress test, ultrasound of the bladder, cystoscopy, urodynamic testing, etc. 5. What is a cystogram? A cystogram is an X-ray of the bladder. Chapter 7. 1. Can urinary incontinence be treated? Yes, urinary incontinence can be treated. 2. What are the treatment options for urinary incontinence? The treatment options for urinary incontinence include bladder training, losing weight, pelvic floor exercise, surgery, electrical stimulation, urethral insert, silicone ring, Botox, nerve stimulation, etc. 3. Can medications also be used to treat urinary incontinence? Yes, medications can also be used to treat urinary incontinence. 4. Give examples of medications used to treat urinary incontinence. Medications used to treat urinary incontinence include alpha blockers, anticholinergics, topical estrogen, etc. 5. What is bladder training? Bladder training is when a person waits a while when he/she has the urge to urinate. Conclusion. Thank you again for listening to this book. I hope it has helped you in your journey to understanding urinary incontinence.